Good evening and welcome to this program, this edition of Let's Talk Politics. I am your host, Michael Gordon, and it is good to be back after quite a while. One of the perhaps most topical issues within the body politic and within the social sphere of Guyana today is the whole notion of COVID-19 treatment care and more prominently vaccination. This really shouldn't be part of a program such as this. However, because really it should be part of a program that deals with health issues, it is an issue that relates more directly to human well-being. However, the political opposition, more specifically the People's National Congress, I don't see them in any other light as prescribed in the National Assembly, have been using the issue of vaccination to spur up a plethora of rumors, a plethora of false ideologies, and also, in my view, and in the view of many, in an effort to counter the successes of the government of Guyana's vaccination campaign. Tonight's program, brought to you specially by the People's Progressive Party Civic, will seek to examine some of the issues of the day relating to COVID-19 vaccines and also some of the solutions that have been put to the fore by government of Guyana. With me, I have the distinct honor of discussing this issue with no other than the Minister of Health, the Honorable Dr. Frank Anthony. Doc, I'd like to thank you for being a part of tonight's program.
Well, thank you very much for having me on the program. It's good to be here.
I'm so happy that we are having this opportunity to discuss this issue, especially as it relates to what government has been doing, what government has done, and what government will be doing in the future as it relates to ensuring, which is in keeping with its mandate as a government, any government, to ensure the health of a nation, among other issues. And you have been tasked with that responsibility as Minister of Health. But one of the issues that have been put to the fore more often than not is the issue of fundamental rights and people's right to choose. And I have to say, the Guyanese copycats have copied what they have seen elsewhere, and I don't want to talk about elsewhere. So it is one's right to determine whether one wants to be vaccinated or not. But we all have to recognize, Dr. Anthony, that rights has to be taken within a context. One's rights are not absolute. There isn't a limitlessness to one's rights. So while one has that right to choose whether he or she should not, if they should not be vaccinated themselves, consideration also has to be given to the rights of those who have been vaccinated. Your take on this, specifically with what has been happening, especially among a very misguided bunch, and in the context that the political opposition has now latched onto this to score political mileage. My question seems to be long. Unfortunately, the political opposition has been encouraging people to protest against government policy, government's position on ensuring that Guyanese are vaccinated as the government strives for Guyana to essentially beat the COVID-19 virus. But they are also putting people at risk, and recent events can prove that those who have gone in groups and large crowds to protest many of those people have ended up being contracting the coronavirus itself. Dr. Anthony, these actions and the the strain it has brought to bear on the health system.
Um, Michael, yeah, I think you touch on a number of issues there. So let me see if I can deal with each one of them. So first of all, we don't have a problem with people enjoying their full human rights. And I've noticed that in part of the arguments that people have been making, that they have a right to choose, they have a right, um, to not get vaccinated. And so that has been one of the chants that we've been constantly hearing. But our Constitution provides for the right to life. And one of the things that we know is that if you are not vaccinated, that your chances of getting the infection is much higher. And therefore, if you get infected, you are also going to get hospitalized and possibly going to die from COVID. And what the government is offering is to make sure that you are able to get a vaccine that first and foremost is going to keep you healthy, it's going to keep you safe, it's going to protect you from getting sick. And even if you do get infected with COVID 19, that the chances of getting hospitalized is slim and also from dying from COVID. So you have before you a solution that can protect you, and yet we see people who are hesitant. But the reason why a lot of people are hesitant, it's because there is what is called an asymmetry of information. Those who are well informed, those who are knowledgeable, have come forward and taken the vaccine because they have done the research and they understand that this vaccine is effective and protective. However, there are persons who might be persuaded by the things that they see on the internet, much of which is not credible, and they tend to believe some of these things. And because they're believing um, things that have no bearing in science, it's not factual, they get confused, they become hesitant, they don't take the vaccine, and they put themselves at risk. And so part of our job is to try to dispel those myths, um, to try to encourage people to get vaccinated. In other parts of the world where we have a responsible opposition, they have been coming forward, they have been helping, they have been, you know, working with the government to make sure that measures are in place that you can fight the coronavirus. But in Guyana, we have a very funny thing that is happening. The people who are in opposition, many of them have taken the vaccine, and however, they have been encouraging their supporters not to take the vaccine. So this is highly irresponsible because they're putting their supporters at risk for contracting the virus. And I really do hope that we'll see better sense and that they would start demonstrate that they are more responsible. And one way of demonstrating that is to really encourage everyone in Guyana to take the vaccine. So we have a challenge before us, and that challenge is really to defeat the coronavirus. And the only way that we can do so is if all of us work together to make sure that we get vaccinated and that we take the relevant public health measures.
Dr. Anthony, notwithstanding what you've said, it also has to be taken into, it also has to be examined within the global context and what the world requires of individuals, sovereign states. And of course, I have been on the ground and I have been hearing some of the stories, and I'm hearing the powerful countries are bullying countries like Guyana. However, we live in a global village in this day and age, and there is significant travel. There is significant movement of people and goods and even services. And because of that, every country, every individual country has ensured that it has and is doing what is required to protect its people. Some countries have spared no bones in doing whatever it takes to protect its people from some of its own people. And I believe that is something that has to be given some context especially in the context of the Ghana situation. You raised a very important point where leaders of the political opposition ensured not only themselves, but their close families and their close relatives and loved ones take the vaccine. Even when, I'm told, even when in instances some of their very close relatives did not qualify, there was that period where vaccines were being given on an age range basis. And many called to have relatives vaccinated who did not qualify at the time. We understand that. What do you say, sir, to your political counterparts, those on the other side of the house, who have been engaged in not only efforts to impede government's initiatives to take Guyana to herd immunity? What would you say to those members on the other side of the house who have also been part of misinformation campaigns?
Well, as I said, I think um, with such a public health crisis, we should not be having these types of debates because we should all understand that we have to work together if we are going to get past this pandemic. Unfortunately, the behavior that we've seen from the leadership of the opposition has not been heartening, has not been a kind of responsible leadership. They probably see it as playing politics. But when you play this type of politics, a lot of people are going to lose their lives. And as I keep hoping that they would realize how irresponsible this is and try to correct their ways. Nevertheless, despite their efforts of thwarting in many ways the vaccination drive that we currently have, I think a lot of sensible people in this country have decided that they're not going to listen to them and that they are going to do the right thing. And so, as of yesterday, we would have had more than 305,000 Guyanese in every single region who would have received their first dose of a vaccine. And of those who received their first dose, we would have had 155,600 or so persons who would have already received their second dose. So for first dose right now, we are close to 60% of our population, adult population that is, who would have received a first dose vaccine, and about 30.5% who would have received the second dose vaccine, meaning that they're fully vaccinated. So I'm heartened that people are coming forward and they're taking their vaccines. Over the last couple of weeks, what we noticed is that there have been an upsurge in people coming forward to get vaccinated. On average, we are seeing between 3 to 4,000 people coming forward to be vaccinated, and that's a good thing. So, if the opposition want to be irresponsible, I think the Guyanese people are much smarter than they are, and the Guyanese people have decided that the vaccines that are being provided are going to help them and protect them and their family, and that is why they're coming forward. So, despite the efforts of the opposition to try to thwart this drive, I think there are lots of smart people out there who are encouraging others and coming forward, and we are seeing the results of that. And I want to thank those persons um, who see the necessity to make sure that they come and get their vaccines and encourage others to do the same. You know, we have approximately 100 sites across this country, and every day that we open them, we are seeing people coming forward. Unfortunately, we still have a challenge in Region 10 where, while we have a number of sites that are open, we are not seeing as many persons coming forward. And Region 10, as you know, have one of the lowest vaccination rates of all the regions. So we need to get that corrected, and I do hope that the people of Region 10 um, are listening and that they can take the relevant measures to go out and get vaccinated.
Uh, one of the very important points you made related directly to the fact that people are coming out. I'm very heartened. Uh, what we are having now because of the run on the vaccination centers, and I want to describe it as a run on the vaccination centers. I would want to describe it as a good problem to the point that there may be specific types of vaccines, second dose more specifically, that the Ministry of Health cannot have enough of. The moment they come, they're going really fast. And just outside your office in Georgetown and many vaccination sites, the lines in recent times tell the story that people indeed have been ignoring uh, the, the, the utter nonsense
So,
spewed
you know,
out of
yeah.
opposition quarters.
You know, today was a very interesting day because the opposition called a protest on the square of the revolution. And while there were a handful of people protesting and having placard with uh, their right not to be vaccinated, on the other side of the road, there was a long line of persons anxiously waiting to get their vaccine. And I think that tells the story. So
Yes,
here you got the minority trying to dissuade people from getting vaccinated, trying to dissuade people from protecting themselves, trying to dissuade people from protecting their family. And the public understand the importance, and that was why they came. They stood very patiently in the line just to try to be vaccinated. And I want to commend them for coming out and getting their vaccine. And that's what we want. We want to help to protect people. And Michael, people in Guyana don't understand how fortunate they are because in many countries around the globe, they don't have enough vaccines. So here is the story. We have vaccines for every adult person in Guyana. If you want a vaccine, there's a vaccine for you, right? You have a choice of vaccines because we have the AstraZeneca vaccine. So if you want AstraZeneca, there's AstraZeneca that you can choose from. If you want a Sinopharm vaccine, we have Sinopharm that you can choose from. If you want a Sputnik V vaccine, we have Sputnik V for you to choose from. If you want a Johnson and Johnson vaccine, we have that too. And more recently, we received the Pfizer vaccines. But because those vaccines can be used in children, we have decided that we are going to use the Pfizer vaccines exclusively for persons below the ages of 18. So right now, the emergency use authorization for this particular vaccine is for persons between 18 to 12, and that's where we are going to use those Pfizer vaccines. I don't know that there are many countries in the Caribbean that has such a choice of vaccines. But people here can choose which vaccine they would like to be vaccinated with. Isn't that a wonderful thing? It is.
It is absolutely. But
You know,
I
you have
think,
all this choice.
but I think what I want to ask a bit about the pains your ministry, the government of Guyana by extension, has gone to ensure that that these vaccines are made available to the citizens of Ghana. It has to be looked at against the backdrop that every country on this earth is competing for those very vaccines. So it's commendable for the government of Guyana. But speak a bit on some of the challenges you've been having in terms of securing some of the vaccines.
So, as you rightly said, there's a global scarcity of vaccines. You know, around the world, not enough vaccines have been manufactured, and so there's always a challenge in acquiring it. So, one of the first things that we did, we reached out to all the companies that were manufacturing vaccines. We reached out to Pfizer, to Moderna, to J&J, to talk to them about vaccines. We reach out to the Sinopharm, the company that manufactures the Sinopharm vaccines. We reach out to the Indian government. We were talking to them about AstraZeneca, the one that was manufactured in India. Um, we spoke to them about Covaxin, that's an indigenous Indian vaccine. And so we have been having conversations with a number of vaccine manufacturers and governments. And the first set of vaccines that we received was actually through a donation from India. And then we also got a donation from China, Sinopharm vaccines. And as soon as we got those vaccines, we start using them to immunize our frontline healthcare workers. And apart from receiving donations, which obviously is not enough, we went out, we worked through a multilateral organization called COVAX. We were part of the COVAX from the very initial stage when they were setting that up. And we also received some vaccines through COVAX. So, one set of vaccines that we got in the country was donations. But after a while, those donations began, it became scarcer. And we had to figure out, well, if we have so many persons in the country, how are we going to get vaccines to get for them? And so we decided that we are going to buy vaccines. The government of Guyana took a decision that we are going to purchase vaccines. And that is why we went out looking for vaccines. So we knew that the Sputnik V was a very good vaccine and its efficacy was in the 90s. And so we reached out to the Russian direct investment funds to be able to acquire some of the Sputnik V vaccines. Like with many manufacturers, they had distributors of these vaccines, and they sent us to one of their distributors, and through that distributorship, we were able to acquire Sputnik V vaccines for Guyana. We have a lot of first dose of that vaccine, and the distributor every week is sending in to us approximately 5,000 of the second dose. And as soon as we get those second dose, we are distributing it out to the population that requires a second dose Sputnik V. So we have been very, very proactive to get vaccines. And then, of course, with the J&J, apart from reaching out to the company, we also use a mechanism through CARICOM, where we had a partnership with the African Union and we were able to purchase some J&J vaccines out of the African Union. Those have arrived in the country, and our desire really is to use them in hard to reach area, because when we go into those villages, it is sometimes very difficult to go back there in a timely manner. And so because this is a single dose vaccine, we want to use these in those hard to reach areas so we can offer the population some level of immunity. And then, of course, we now have the Pfizer, which we'll be using with our children population. So it has been a lot of hard work, working with different companies, distributors, countries. The government has not spared any effort to make sure that this country, that we have enough vaccines for everyone who would like to get a vaccine. And I really want to commend the team at the Ministry of Health and all those other persons who have helped us to roll out this vaccination campaign. It is not easy because we are distributing vaccines in every region of this country. And we literally have hundreds of staff that would come to work every day very early, get out there and immunize people. And, so far it has been going very well. The staff has been very professional in trying to make sure that every Guyanese get their vaccination and so that they remain protected. If we continue at the rate that we are going, then we'll be able to achieve herd immunity before the year ends. However, if we start seeing a lot of hesitancy and the rates of vaccination drop, then it would be longer before we can get close to herd immunity. If we don't get enough people vaccinated and fully vaccinated, it will take longer for us to open up back the society and return to some sense of normality. So, if we really want to get back to some sense of normalcy, then all of us need to encourage our friends and family and everyone we can, talk to come out and get the vaccines.
Absolutely. One of while you were explaining the efforts that government have made in terms of attempting to secure the vaccines for the people of Guyana, it must have been costly also because of that global demand and the global shortage. So there is a paucity of supply, significant demand. My little economics knowledge tells me the prices will be very high.
Indeed, it is. And, you know, as shortage continues, you are getting a challenge to secure supplies and to secure at the right price. And that is one of the reasons why, for example, that multilateral organization, COVAX, what they are trying to do is both these manufacturers, and because they are buying billions of doses, they want to try to drive down the price. But even that, um, they are having challenges getting supplies. And when they try to negotiate to say, well, we're buying this volume, give us a cheaper price, the manufacturers are saying to them, well, hey, you know what? We can't do that cheap price. We can go and strike a bilateral deal and get a better price. And we are going to do that instead of, you know, trying to be giving you guys a lower price. So it has been challenging securing vaccines and getting it at a cheaper price.
Okay, very topical today. The government of Guyana, more specifically the Ministry of Education, is now moving to have schools reopened. I was hoping, and I still am hoping, at some point to have the education minister on this program, Honorable Priya Manikchand. But as the Minister of Health, the man responsible for the health well-being of this entire nation, including our nation's future, our children, uh, speak a bit to your own assessment on why the decision, because of course it is being questioned by many, the decision and the confidence that the government holds in the decision to have school opened in the coming weeks, reopened rather.
So, one of the things that we have to understand, COVID has changed the way that we are doing business. And one way is the education that the education system, we had to shut schools down. Children were not able to get their education in the regular way or the way that they were accustomed to. That is going into a classroom. We try um, to change the format by having the learning channel and teaching on the learning channel so that those children who are at home can follow some of the lessons through the learning channel. We also use radio to try to broadcast some of the material. We were also using online methods to reach out to children. All of these are good ways of trying to stimulate education. But as the educators would tell you, it is sometimes absolutely necessary to have a child in the classroom. And around the world, there has now been a deficit in education, meaning that the quality of education that children should have received over the last year was not there. And so there would have been that education loss, so to speak. We also in Guyana, we would have suffered some of that loss. And if we want these children to catch up, if we want them to be able to write their exams on time and don't fail those exams, then it is important that we work to reopen schools and reopen them in a very safe way. So, with the reopening, what we have to do is to make sure that we observe all of the public health measures, such as sanitizing, such as wearing masks, and when the children are in the classroom or in an enclosed environment, that they maintain certain distances. The Ministry of Education and the Ministry of Health, we have been working closely together. We have a technical team that has been looking at this, and they have given the Ministry of Health team have given the Ministry of Education certain basic guidelines that they should follow. The Ministry of Education has been following these guidelines, and so when school reopens on the 6th, those guidelines would be in place for the school reopen. Now, one of the other things that we want us to do for the children who are in secondary, meaning children between the ages of 12 and 18, they have another opportunity, and that is another opportunity to be safe. And that is, they have a vaccine that is currently available for this age group, the Pfizer vaccine. And we are going to start rolling out that vaccine as of tomorrow. And we want to urge every parent to encourage their child to get the vaccine. Because once you get that vaccine, your child is going to be much safer. Some people believe that children are not being affected by COVID, and that's an erroneous view. Because since the pandemic started in Guyana from the 11th of March 2020, we would have had more than 4,000 children being infected with COVID. There were some of them who really got um, a severe form of COVID and they ended up in the hospital. And so this is a serious thing. Now, we also have, and we have to look out for, what is called Delta variant. This is a mutation of the original virus that is more infectious, that is more transmissible, and in many ways, it is causing more hospitalization. And the hospitalization that it's causing is not just in the adult population, but also in children. And so, before yesterday, we did not have a vaccine for children. But as of now, we do have a vaccine for children. and we intend to roll that vaccine out. But for your child to get this vaccine, we need two things. One, we need to verify the age of the child so that that child meets the age requirement. So once they're between 12 and 18, they can get the vaccine. And then the second thing that we need, because they are below 18, they themselves cannot give consent. So we have to receive the consent of the parents. And so there's a letter that the Ministry of Education has been circulating for those persons who are out of school. They can download that letter from the Ministry of Education website. They can get it filled up by their parents, and they come to one of the vaccination sites that we are giving the Pfizer, and you would get vaccinated. So it's a very simple process. So tomorrow we'll start that process. We're doing a test run, and after that, the vaccination teams would be going across to the different regions to make sure that every child between the ages of 12 and 18 who would like to get a vaccine, they would be able to get that vaccine. So this is another way of how we can keep our children safe and we can reopen schools safely.
What are some of the areas in which the test run is going to be rolled out, or perhaps some specific schools? Is there a particular age category between 12 and 18, or it's the broad catchment age of 12 and 18? Are there
Anybody
some?
between yeah,
Go ahead, sorry.
anybody between 12 and 18.
Okay.
So tomorrow, when I said a kind of test run, tomorrow what we're doing with the Ministry of Education and with the U.S. Embassy here, because as you know, the U.S. government, through a bilateral arrangement, has donated these Pfizer vaccines to us. So we received the first tranche of these vaccines. We got 146,000 doses, and we have a number of other doses that will be coming in later. So tomorrow, what we'll be doing, we'll be having a press conference and a rollout of the first set of vaccines. So the first set of children would receive those vaccines tomorrow, and thereafter, at tomorrow's event, we will unveil a schedule of which regions, when we'll be there, and so forth. So the team at the Ministry of Health, we have been collaborating with education, and we want to do a lot of these rollout in schools. But if we're in a particular village, we'll go to that school, and the young people in that village, whether you're attending that school or not, you can come there and get vaccinated.
That's very informative, Dr. Anthony, and I must commend the effort and the collaborative effort between your ministry and the Ministry of Education. There are a number of factors, however, that I would want to know. I would like you to talk about as it relates to more specifically things such as the sanitization of schools and those types of things. You spoke broadly to guidelines being given to the Ministry of Education, but I'll ask you to be a little more specific as relates to those guidelines, which may include the sanitation at schools and so on.
So one of the key things that we want to do and we want to maintain in schools when children go back is to make sure that they have masks. And the reason why that is important because COVID-19 is the transmission is done by a virus that if somebody coughs or sneezes, it would get into your nose or mouth, and you can get infected. So if you have a mask on, it helps to prevent that from happening. And that's why it's important that children who are returning to school that they wear masks. So We are going to insist that children who are coming back that they have masks. And I think the Ministry of Education, if the child does not have a mask, I think the Ministry of Education um, perhaps would be able to assist in providing some amount of mask for those who don't have. But this is a very, very important thing because just per chance, if there's a child that is infected, by wearing the mask and keeping the distance, it would prevent the spread of infection. Distancing is very important, and that 6 feet that we often talk about, it is because if somebody sneezes, the droplets from that sneeze would not go for more than 6 feet. So if you are out of range, so to speak, then those droplets would affect you. But we also know another thing with COVID, and that is there's something called aerosols. These are fine particles that can remain suspended in air if the room is enclosed and there's no proper ventilation. So, to prevent transmission by aerosols, we have asked the Ministry of Education to make sure that schools are properly ventilated. And so they have been working to make sure that that happens. Also, one of the things that they have done is to put in at every school uh, sanitization stations where you can sanitize your hands so as to reduce the spread and transmission of COVID-19. So, the Ministry of Education, as far as I know, they have an assessment team that has been going out from school to school, checking to make sure that all these measures are in place. And once those measures are in place, then that school is ready to reopen, and they get the green light to go ahead and open the school. So that's what is happening. We want to make sure that schools are reopened in a very safe environment.
The issue of presenting vaccination booklets at, at government and state facilities have been there has been much debate surrounding this issue. There has also been some suggestions relating to the creation of a vaccination passport per se. There are also suggestions in relation to perhaps a vaccination, a card for those who have been fully vaccinated that mirrors an ATM card for the sake of convenience. Uh, at what stage are we in relation to that particular initiative, the passport, and also the plastic card per se?
So a couple of things are happening. The card that you currently have, you're required to have that card with you all the time because to access government services, if you're vaccinated, you will get relatively free access to come in and do your whatever services that you need to do. But if you're not vaccinated, then you'll have to produce a PCR negative result that is within a 7 day period. If it exceeds 7 days, then you have to get another one uh, because people want to make sure that that person is not infected with COVID. So persons have a choice. You have a choice. If you don't want to take the vaccine, that's entirely up to you. Then you don't want to take the vaccine. Then bring your negative PCR and you show that. And once you're negative, then you'll be allowed access. So that's what is in place, and I think a lot of people have been complying when they try to access services. So outside of that now, the cards that we're using, a lot of people have been complaining about them because it's paper based, and sometimes people tend to lose the cards and so forth. We have been working with the government of India to bring in a software called CoWIN, and that's going to help us to digitalize all our vaccination records. And so once we have that in a digital database, it would be easy to print electronic cards for people. So we are right now sourcing that CoWIN software and sourcing the hardware to go with it. And once we get the two things together, we have staff that has already started to do some of the digitalization. So it's just about building that database and start printing out those smart vaccination cards. Those can be used. They're going to be plastic cards to contain your basic information, and those can be used to move around quite easily. And they would have special card readers that would display the person's information and to say what type of vaccines and things like that. So we would be moving in that direction, and we're working very hard to accelerate that particular service for the people. So once we get that going, persons with the paper card can come back in, and we'll basically exchange the paper card for the plastic one. But that would in a couple of weeks' time we'll be able to talk more about that.
It's very important that we discuss that, but there is also, and our time is fastly going. There's also one other pressing issue as it relates to, and most of the issues I am raising with you, Dr. Anthony, relate to some of the things that are being said in the public domain, and there are questions relating to those, uh, and misinformation as well, that sometimes, even though we may have clarified it before, for want of emphasis, I think it's very helpful to hear it from the horse's mouth. Even again, this deals with unvaccinated Guyanese and unvaccinated visitors traveling to Guyana. There is a clear distinction. We have spared no effort in explaining it, but yet those questions continue to come to the fore. And as I said, it is sometimes it's sometimes better to hear it from the horse's mouth, at times more than once.
So traveling into Guyana is a very simple requirement. You need to have a negative PCR, and if that PCR is within 3 days, then when you arrive at the airport, you don't have to do a second one. If it's more than 3 days, then you will have to do a second one when you come in at the airport. In addition to a negative PCR, you will have to also show proof of vaccination. And for now, once you have at least your first dose of a two-dose vaccine, that would be acceptable. So that's the basic travel requirement.
It's pretty straightforward, and I'd like to thank you. Our time is gone. Dr. Frank Anthony, Minister of Health. We have been discussing many issues, questions, and deliberate, misguided information, misinformation being peddled in the public domain as it relates to government efforts to bring Guyana and Guyanese to bring the country to a point of herd immunity where the citizens of this country are protected from COVID-19. Your parting words, Dr. Anthony, as your ministry and now in collaboration with the Ministry of Education and all other ministries of government, but more specifically, as we prepare to see the new school year through, some parting words as it relates to appealing to Guyanese to ensure that not only each and every one of us as individuals, but our responsibility to ensure loved ones are protected from the coronavirus.
So basically, it's a simple message, and that is get vaccinated. If you want to protect your loved ones, then the best way to do so is get vaccinated and ensure that they are vaccinated. Once we can do that, we'll all be protected from this virus. So please don't let people create confusion for you. Just do the right thing and make sure that you protect yourself and your family, and so that you can live a long and healthy life. That's what we want for every single one of us.
So you've been watching Let's Talk Politics, and those of you tuning in on Freedom Radio, you've been listening to Let's Talk Politics. My host tonight was Minister of Health, the Honorable Dr. Frank Anthony, and we've been discussing a range, a plethora of issues surrounding uh, government's efforts to counter the coronavirus, as well as which includes tremendous efforts to ensure every Guyanese is vaccinated. This is a special program, Let's Talk Politics, brought to you by the People's Progressive Party Civic. I'm your host, Michael Gordon. Wherever you have been joining us tonight, thank you for being a part of the program. Join my colleague Edward Lane tomorrow at 8 p.m., and I'll be back with you on Friday at 8 p.m. Until then, bye-bye.